Excellency Obabadula, former Speaker of the House and also former President of the great state of Oromia, and Professor Kim and Council Minister, Korea Embassy, invited guests, and also our board members, volunteers. Thank you for being here today. Today is a very special day for us. Today is where we look at sustainability, scalability, and synergy. About 2 years ago, my uncle had a heart attack, and that same day, he died. And that same day, I took care of a patient who was 92 years old, and she's alive today, but he's not. Where you live should not determine whether you live. But in Ethiopia today, more than 15,000 patients, young patients, and families are painfully waiting for life-saving cardiac surgeries. Many years ago, Ethiopia sent 6,000 soldiers to support South Korea. But our future soldiers, future doctors, future engineers, and entrepreneurs are sick today. Our future is sick, not because of absence of technology, but lack of access to life-saving procedures, preventive technologies, and equitable health access to healthcare. I am a proud son of Ethiopia. I went to medical school in Ethiopia, paid nothing for 8 years of medical school. I ate 3 times a day at Black Lion Hospital. My wife, on the other hand, she went to medical school in America, and she had to pay over $200,000. And I am the one who went to medical school in a poor country, and she went to medical school in a rich country. So this is not really a choice for me. Doing this is what I am supposed to do. This is the expectation. I am coming back to support my country. So the journey, thank you. So the journey started as a mission. It's not because we believe an episodic mission-based intervention will solve this problem. Far from it. We've done multiple things via mission. We went to the moon through mission. We're trying to go to Mars through mission, but we don't live on the moon. Mission by its very nature is very short-lived. And it shouldn't be by chance that when people have a heart attack, massive stroke, or aortic dissection, or a tamponade, they survive when our missionary group is here, and they die when we're not here. Accessible, advanced cardiovascular service should be made available 24 hours a day, 7 days a week. Emergency cardiovascular services, they don't happen just during the day, or they just don't happen over the weekend. They happen anytime. Now, don't get me wrong, cardiovascular disease remains, unfortunately, to be the #1 cause of death in the world. 20.5 million patients die every year. But the most disheartening part of all this is 80% of cardiovascular mortality actually happens in low and middle income countries like Ethiopia. Just sub-Saharan Africa, 250,000 people die from hypertension, a condition that if it is identified and a single antihypertensive can save lives. Hemorrhagic stroke, you guys know. Heart attack, you know what happens. Young people die. Rheumatic heart disease remains to be one of the leading causes of mortality in Africa, with over 300,000 patients dying every year. Most of the 40 million rheumatic heart disease patients are still in Africa. A very simple, treatable, even WHO defined it as the neglected disease of the poor. But most of that is not because we don't have smart doctors. It's not because we don't have beautiful facilities. It is because we did not want to take the step, the hard step forward to build systems. Unless we build systems, it doesn't matter how beautiful the hospital is. It doesn't matter how smart the doctor is. The patient will still die. So that is where the sustainability, the scalability, and the synergy comes in. We've been to Ethiopia. This is our 4th time. Last week, on Monday, our amazing volunteers started their mission in the morning. Today, they're still working, and by the end of the day, we will have completed 101 life-saving cardiac surgeries. So the most important part of that message is the fact that it's done in 1 week. Imagine what we could do if we're here every day. Every day. How many hospitals in Ethiopia do 101 life-saving surgeries in 1 week? I'm not criticizing. We have to be synergistic. We have to build on what we already have. There's no reinventing the wheel. We have ORs. MCM Hospital has 7 beautiful ORs. We have excellent surgeons. We have 15,000 patients on the waiting list. We have beautiful ORs, excellent surgeons, and patients. So what is missing? Why are we not taking care of these patients? Right? It's very simple. So we haven't built a system. So we have to build a system. We are a poor country, right? I don't like to use that word. I don't believe Africa is poor. I don't, honestly. I don't. We have tremendous resources, unused resources, manpower. 1.4 billion young people with median age of 17 years, with more than 60% of the population under the age of 25. Why are we dying? Why would where we live determine whether we live for so many years? Why is that? It's hard for us to understand the epidemiologic transition is here. It's not unique to us, where more people die from non-infectious diseases than infectious diseases. This happened in the UK, happened in America, but the infrastructure developed. The way we train people developed together. Today, the epidemiology has shifted. Yes, we still do have a good number of infectious diseases, but non-infectious diseases are killing more people. So where is our budget? Still on infectious diseases. Where is our emphasis? Yes, well, we have made some move to recognize. I would like to acknowledge the Ministry of Health for making disease priority to non-infectious diseases now. But I think we have the opportunity. Mission is not going to solve this problem. We have our footprint at 3 major amazing institutions, the Cardiac Center Ethiopia, where we started our very first mission with 6 volunteers. 6, John Allen smiling, he was there. So 6 volunteers. And then second mission, third mission, we expanded to Black Lion Specialized Hospital and St. Peter Hospitals. So our footprint is growing. If you are not paying attention, you don't see where we're going. Where we're going is where we can reach everybody. Really, every time we come, we leave a bigger footprint. And this is really, really way bigger than I expected, but it's very exciting. We're not leaving anybody behind. The first time this message came to me, I was a little bit confused because I didn't know what MCM stood for. But after a little bit of back and forth with Professor Kim, the foundation for the MCM hospital and the foundation for Heart Attack Ethiopia is exactly the same. It's charity, through philanthropy, solving a nation's problem sustainably. Sustainably. So, yes, Mr. Abebe doesn't have money, he has a stroke, he gets treated. Mr. Bekele has money, has a stroke, gets treated. Heart attack, gets treated. And maybe Mr. Bekele may be subsidizing Mr. Abebe. We have to figure that out. But Ethiopia today loses hundreds of millions of dollars to medical tourism to Thailand and India. It just doesn't make sense, right? So if we can retain all this money that is going, it's the scale of Africa, it is more than 500 million. We have a fantastic airline, Ethiopian airline, with connectivity to all over Africa. Very easy to do medical tourism. Why don't we be, on the other side of the equation and maybe think bigger? So, I'm very excited. I don't know all the details for our partner hospitals. We're not going anywhere. We're just growing. It's just our footprint is expanding. Let's build this synergy. And to our amazing volunteers, thank you so much for dedicating your life. And I think this is going to be an amazing legacy where you still come, but you come for experience exchange, to expand complexity, maybe to treat younger children that we're sending to India now, neonates, complex things. You don't come to do everyday bread and butter cardiology. That is my vision. And that really can happen in 5-10 years. It can. We just did the first ever transcatheter aortic valve therapy last week on a mother, and she's home today. That one valve is $25,000. But if your intentions are correct, if your intention is to genuinely solve a problem, and if you know what you're doing, the world is behind you. Most people are generous. Look at these people. They can go on a vacation, they can be on the beach right now, but they're here working 14 hours a day, every day. They're working today, Saturday. So but it is our responsibility. It is my responsibility as an Ethiopian to identify my weaknesses, build on my strength, and invite people to help me build something that will sustain for future generations. So let's build legacy, let's build Ethiopia, let's treat those children, and let's mend those hearts. Thank you so much.